So gallbladder problems or gallbladder attack typically occur after a patient eats something usually fatty, spicy, greasy, so it's a fat-enriched food. They'll have abdominal pain in the center, sometimes right upper side, sometimes nausea and bloating. It may radiate to the shoulder and back area, to the lower part of the shoulder blade is very typical. They'll come to their physician or sometimes they'll come emergently to the hospital, to the emergency room, at which time blood work will be done to look and see if their blood tests are abnormal, such as elevation of their liver tests, for example. Also a right upper quadrant ultrasound, so imaging of the gallbladder to detect if there's stones or not, if there's inflammation of the wall or not, is there fluid around the gallbladder, the tubes that drain gallbladder bile out of the gallbladder into the intestine, called bile ducts, if they're dilated or abnormal. Those are things that will come up abnormal on that testing. So gallbladder attacks can often be confused with many other things. Sometimes patients will come in thinking they're having a heart attack and they'll be ruling out for heart attack and chest pain protocol. And that all rules out, and then a right upper quadrant ultrasound will be done after the fact, because upper GI symptoms and cardiac can be confused and mimic one another. Also, gallbladder sits very close to the stomach, so acid peptic disease can mimic gallbladder pathology as well in terms of an ulcer or gastritis. Inflammation of the stomach can be very similar in terms of type of pain and location of pain, similar to gallbladder. If a patient presents and has documented gallstones and a documented attack consistent with a gallbladder attack, then typically they need surgery. If the patient chooses not to pursue surgery, likelihood is better than not they'll have another attack. But if they steer entirely clear of fat-enriched foods and use a completely lean diet, there's a possibility they may not have another attack. But typically, unless the environment of the gallbladder containing the stones is altered, in other words, removed, they'll probably have another attack.